So I think it is a particularly interesting time to be in the situation where I am, which is to be in um, a recovery house, a sober living house, a recovery program, however you want to put it. It's an interesting and kind of strange place to be in life to begin with, but with the COVID virus and all the ramifications of that, it's really a strange time. And so I just wanted to kind of talk about that and how things are here, where I am right now, and specifically the therapy aspect of it, because we are all supposed to be receiving therapy on a regular basis. We're scheduled, I believe, for 11 hours of therapy per week, which is quite a lot. Um, and we do that currently in the form of three-hour group sessions and then two 1 hour individual sessions. And I've been told by people who have been here longer than I have that before COVID hit, that the therapy sessions were, we'll just say, more beneficial. And currently, they're just not. They're not helpful to anybody. The company is, the company is fulfilling their requirements so that they can bill insurance companies, and we're just sitting through completely empty time. And the main reason for that is the quarantine. One of the rules is that um, we're doing as much social distancing as possible, which means that those 9 hours of group sessions are being done over video. Um, Video chats, meetings, online meetings, and it's just a recipe for disaster. The one moderator just really has difficulty handling people who are coming from multiple cameras. That's not what they had in mind when they started a job like this. Um, Group therapy is supposed to be a group of people all sitting around paying attention, talking with each other, and we don't have that now. We can't have that now. It's impossible to really monitor everybody. Um, and then the therapist, seems like they would be really good in a one-on-one in-person setting, which is probably what they had in mind when they got started doing what they're doing. But now they're trying to lead these online meetings, and that's just not their strength. So we have just a whole lot of downtime. We don't really get to cover a whole lot. In a typical 3 hour session, maybe we get 10 minutes that are beneficial. Um, and I hate saying that, but it's true. Um, and hopefully, when the quarantine passes, that'll be better. That'll be improved and it'll be more useful. Um, the one-on-one therapy is also just, it's being affected by different things that are going on, partly because of COVID. So scheduling is strange. The meetings are a little strange. I'm still fairly new, so I haven't had a lot of those sessions yet. So I'm gonna try to give them a little more, give them a little more time. But I really haven't had any actual therapy yet in 2.5 weeks, and that's okay, because the big part of what I'm doing is just learning to live, among a group of people here, and to just get through the days and whatever little stressors come up. Learning to do that without, self-medicating, basically. Um, and so far, that's not too hard, but it would be nice if the therapy were more beneficial. I mean, part of the reason that I came in when I did was just thinking that, well, there are no jobs really right now. There's no work to be done. I guess this is as good a time as any to go in and, work on myself. But COVID has affected the therapists more than it has affected the patients. Um, and so because of that, we just haven't had anything really useful. So it's interesting to note just the the reach that this virus is having on the daily lives of people that you probably wouldn't initially think about. I wouldn't think about somebody who's in therapy not being able to get therapy, because this doesn't just go for people who are in a lockdown living situation. It could go for anybody who needs to have therapy or even a doctor visit. I was supposed to have a doctor visit last week. I'm, medical doctor, and I did. I went into an office and I got on a webcam and I had a discussion, and the doctor kind of guessed at what was going on and just straight up said that they really couldn't see it. They couldn't see what was going on. They couldn't see like my symptoms properly. So it's got to be affecting a lot of people's health care. Um, if doctors' visits aren't canceled, they're perhaps being changed to telehealth, which is a really great idea, but the cameras need to be better. As far as I know, when a doctor wants to examine a person, they look at them and inspect them. So it's just shown a lot of the challenges that are going along with this. If you're not really sick, but you need therapy or you need basic medical care, those things are a lot harder to get right now. And I guess it's just really, really very clear when you're in a situation like I'm in, and you're supposed to be getting therapy basically 5 days a week. I guess it is, yeah, Monday through Friday. 5 days a week, I'm supposed to be getting therapy of some sort, and I'm not really getting much. But unfortunately, I can't be working during those times, so I can't work a regular 9 to 5 sort of job because I would have to miss part of my workday every single day. So I just can't work a regular 9 to 5 type of schedule while I'm here. So it's just an added challenge, added layer of complexity or difficulty here with what's going on. And a lot of people have it a lot worse because of this virus, whether it's themselves or loved ones who are sick. I'm fortunate not to have to deal with that. Siren outside. Anyway, like I said, there are people with bigger problems. And I don't know. I guess it'll just take a while to see how this works out. But it was really the topic of conversation today, was just how we're struggling to get much out of our therapy sessions. And I really hope that this is over soon and that we can get back to something more normal, so that I can get the benefits from this that I'm hoping to get. Otherwise, it's not a good time to come in like I thought it was, but it's a really bad time because there is a lot of frustration building up, and where I could be looking for different types of work, whether it's online or wherever, it's just a little more difficult here. So I don't know, just more kind of thoughts on what this virus is doing to everybody. And even though I'm not directly affected by it at all, it is definitely having a major impact on my life and on my recovery. And, it has to be the same for lots of people all across the country or across the world, who need medical attention, whether it's, mental health or physical health. I wonder how many people are getting sick with things that would otherwise be taken care of. Not necessarily the coronavirus, but just things that a doctor's visit would normally clear up. Um, because the doctor I met with basically admitted they didn't really know what was going on. They just took my word for what I thought was going on, and used their authority to either prescribe or not prescribe anything based on my self-report. And that's dangerous when they know that I'm in a house full of people who have substance abuse issues, to just trust the patient and give them the medicine that they think they need, because that's just asking for um, problems on a whole different level. So anyway, just rambling on this, but it's an interesting thing that's going on, and it's not good. And hopefully it'll be taken care of soon. But as I said yesterday, I want people to be safe. So it's just a tricky situation. And all I can do is the same thing that anybody else can do right now, which is try to be patient, realize that this is going to pass, things will be getting back to normal, and one day at a time, and let things happen the way they will. All right. On that note, I have to get up for therapy in the morning, so I'm going to try to get some sleep.